Welcome to today's video. Today is a little bit different and it's a lot of a treat because we're going to talk about Botox. Okay, specifically injectables. Specifically, a few months ago, asked on my Instagram stories who gets Botox and where they go and what do they think and how much do they pay and how do they feel about it. I wanted to talk about Botox. This practice, Dr. Sawyer specifically, she's like the OG. She is like the queen godmother of Botox in Birmingham, and people travel from all over to see her, not just for their injectables, but also their laser treatments. We did not go super into the laser treatments. This was really my first experience at a cosmetic dermatologist practice. So what that means is specifically people are going there for their looks, injectables, fillers, laser treatments. Let's get started. Full transparency here, I was not paid for this post, and everything I share are my actual thoughts and feelings. Good morning. Here I am barefaced, about to walk into Dermatology and Laser of Alabama. They have invited me to come in and experience their treatment, their facility, and just learn more about what they do, because the truth is I feel like really uneducated in this realm, and a little nervous. So I want to take you on the journey with me and share with you all the things that maybe you're wondering about too. I think one of the gifts of being a 41-year-old woman is obviously all the wisdom I've accumulated through the years, and also profoundly knowing myself. I will be honest, I've been very kind of nervous and on the fence through my 30s about injectables. I didn't know if I would have a bad reaction or if it was something that goes against my values or whatever, and I was really like overthinking it. I also kind of like in the back of my mind was like, you know what, if the day ever comes, I will know it and I'll know what I want to do. I have a very expressive resting face, and my family will often look over at me and be like, ugh, what's wrong? Why are you mad? Why are you making that face? And I'm like, oh my God, this is just my face. To do a little conscientious toxing, like alleviates miscommunication via visual facial cues. All right, I'm about to get a bunch of needles in my face. Come with me. I love this building. It's like a 1974 wellness resort. All right, are you ready? Let's go. I didn't know exactly how to prepare coming into today, except maybe to not put anything on my face. That feels like the right thing to do. I didn't even moisturize, so I'm actually feeling really dry and tight. Okay, we're about to walk into the treatment room and see Dr. Sawyer. I'm so nervous and I don't know why. All right, here I am with Dr. Sawyer. How long have you been doing this?
22 years. I went into dermatology because it was patients of all ages, men and women. They were, it was procedurally based because I like procedures, but I also didn't want to miss out on the patient interaction.
Is it mostly women coming in? And what do you find are the major desires and concerns you see?
I think it will always be predominantly, led by women. I do have male patients. If they're in a career where they're highly visible, they like to pursue natural looking solutions. A lot of men come for hair loss. We have a really successful hair loss program here. So different reasons for men and women to visit.
What do you find most patients come in for the first time? What are they nervous about? What are the misconceptions they walk in with that you could dispel right away?
Oh, I think the way that some people look with too many injectables is the number one thing we're fighting right now, because too much looks terrible. Put in the wrong place, injected poorly. A lot of times patients will push their desires onto a provider. It's hard to confront that. A lot of times it's not what the patient wants to hear. I've found that just truth and honesty, and then sometimes just saying, I'm a more conservative injector. It sounds like you might need somebody that's more aggressive. Just making sure it's a good fit.
If people come in and they have gone too far. Is there coming back from that?
Yes, yes. Some of my proudest moments have been helping somebody, and there's an enzyme that dissolves hyaluronic acid filler. My best moments have been helping somebody kind of recover from that overfilled syndrome.
And what is your approach when you have someone coming in for their first treatments ever? This is the second time I've ever gotten injections. My face is like holding nothing right now. How do you recommend they think about their trajectory? Do you really look at it as like, let's just look at this right now? Or do you start planning your journey?
It's really up to the patient. If we have a really good system, we like to have people prepared. And so we have a cosmetic consultant who's worked with me 10 years. She basically does a better job than I do. Explaining, talking through. She's a great listener. Patients really feel loved and appreciated and understood when they meet with her. She talks over every patient with me, and then the patient comes in, they feel very comfortable. We visit for a moment. If it's the first time I'm meeting someone, make sure that I understand what they want and that they understand what they're getting. And if all systems are go, then we proceed with treatment.
Here we go. I want to look like myself, my most radiant version of self, obviously. I really defer to you in the way that you see faces, the way that you see women in their early 40s who are maybe coming to the treatments for the first time. And yeah, I think the goal, which I imagine everyone says, I want to feel like my most radiant self.
The day you get the injection is not the day that you notice the effect. I think that's important to know. Do you always wear your hair pulled back?
Yes, I have a giant forehead, which I've come to love. But I'm not loving the sudden many wrinkles I'm getting. And I'm getting like vertical and horizontal at the same time. My loving husband, cameraman, will walk into a room recently and see my face and just take a photo and text it to me so I can see the full range of the looks. We laugh about it.
I'm glad you're laughing. That's you got a good sense of humor.
We must.
To keep from crying.
That's right. My crying face looks like this.
We'll start with the forehead. So the forehead has one muscle. It's the only muscle in your entire body that lifts your brow. So you want to really be careful, especially if somebody doesn't wear bangs and their entire forehead's always visible, that you don't overtreat. I'm always conservative the first time, and we always tell people you may need to come back because I'd rather do less than you need and you need more than too much, which takes a while to wear off. We start low and slow on the forehead.
Okay.
I take a careful map. So I draw a map of exactly where and how much and what I put in your face so that when you come back and give me feedback, I can go to my map and change it based on what I actually did.
Yeah.
The frown is a lot of times the first place that people will treat.
That would be what people call the 11s.
Right, the 11s. Yeah, or we call it the glabella. You're treating all these different muscles. Some of them pull in, some of them pull down and in, and then the procerus just pulls down. So you want to release the right fibers and leave the right fibers.
And I hear a lot of people talking about the lower part of the face. It feels like we're familiar with doing things up here. What are the different things people are doing in the lower part of their face?
Most common is the depressor anguli oris. That, boy, you've got a strong one.
I know.
Congrats. Yeah. I can relax that some. I can't inject too far up the DAO because I'll run into the DLI and then you'll bite your lip when you talk and stuff like that. So we've got to stay inferior and a little lateral. So I'm going to keep that safe, but it will help a little. Later, we probably talk about filler for the volume loss. And then also the filler, it has this really cool myomodulatory effect where when you've got filler under a muscle, the muscle can't crank as much. So it softens the muscle, but in a different way. We also do lip flip. I do a lot of TMJ injections, and I've started to do some neck injections. A lot of my patients have not just wrinkles, but they have tension. So product choice. There are 5 products in the market. I inject 4 of them. The newest one I have not adopted yet. There's no particular reason other than I feel like I kind of have everything I need. Botox, Dysport, Xeomin, and Jeuveau.
Can people switch between products?
It's not a good idea. It's a better idea to start with one and stay with one. Now, if there's some reason in different people, there are different body chemistries, and we really don't understand why, but a lot of people will have a preference, and they'll tell me that spending the same amount of money on Xeomin gives them a better result than, for instance, like the same amount of money on Botox.
Yeah, do you find people coming in 3 to 4 times a year?
Yes, most of my patients come 3 to 4 times a year.
Do you wait until it's completely worn off? Or
no, because then you lose the prevention. You lose that preventive effect. We're doing it so you look good for 3 months, but more than that, we're doing it so you look good into your aging years. And we stop these wrinkles of motion. Sometimes budget will determine how many areas we treat. I would say most people don't come in and get the works.
Yeah. What do people, what is the typical beginning budget that you see many patients coming in with?
A lot of people will come in, we'll do 25 units in their frown, in their 11s. We see how that goes.
As you have seen patients for many years, do you find that the evolution of the way their face looks from product, does it continue to evolve, or are you able to maintain roughly the same goals?
Yes and no. We can't treat every muscle in the face. That would look weird, and then that would cause some real dysfunction in the way we talk to move. So sometimes what I see is, and especially if you start later, I would call later 40 plus.
We're a late start.
Little bit late, not terrible. Still don't have deep resting creases, so for you, not a problem.
So it's really important for your patients to really communicate to you what they're liking, what they're not liking, which can be hard.
I'll ask people to talk on the phone and look in the mirror after 2 weeks. And that way they're making their natural emotional, movement. They're not frowning on purpose. And then if they can come back in, we'll tweak it if there's something bothering them, or I'll tell them, take a video, show me the next time, and we'll tweak it from the video.
Is there anything that you would like to add?
A lot more people are now able to inject, and that includes people that may not have the right training. Be careful. There have been some really dangerous episodes of fake product or fraudulent product being injected into people's faces. So that's the number one danger. Obviously, you want a great aesthetic effect. So you want to go somewhere that I recommend board certified derm or plastic surgeon.
Are you ready to put some needles in my face?
Well, let's talk about it.
Okay.
Tell me what areas are bothering you.
This.
Okay.
This.
Okay.
This.
Okay.
Is there anything that you see?
I mean, do you want me to treat you like my sister?
Yes. Yeah, please do.
You've got a little background redness. I think you have mild rosacea. We would want you medically optimized. That includes some skincare recommendations and maybe a prescription. The intense pulse light, which is, we use the BBL, the Cyton BBL, which is my favorite anti-aging laser. There's no downtime. I recommend 3 or 4 a year, especially at 40. We would do that every time you came in for Botox. I've seen that device really change the trajectory of aging as much as Botox. Ooh. All right, I'm gonna have you lean back. All right, turn towards me. Perfect. All right, lift your brows. Okay, so now I'm gonna kind of treat the edges. All right, done with forehead. Strong frown. Ooh, yeah, strong frown. Okay, now relax. All right, now frown again for me. Okay, now relax. So you're recruiting just a little over here with those muscles, and we'll take care of that too. DAOs, which that's the one that pulls and makes this work. So say E for me.
E.
Okay, relax. You're done.
Wow. Look at that. Typical appointment. Someone's already talked to Rachel, the coordinator. You come in to the treatment room. How long do people see you in a typical appointment?
5 to 10 minutes for a Botox.
Cool.
For a filler, it's longer.
Thank you so much.
So nice
This has really been a pleasure.
Oh, same for me.
Yeah,
same
thank you for sharing all your wisdom too.
Thank you.
I feel really informed about this process now. I think so much of it is the trepidation around your first time coming in and really not even knowing what questions to ask.
Sure.
All right, so I've just completed my treatment, which you can tell. This will go away in about 30 minutes. I feel so much more relaxed now that we're done, and I knew what it was like, and it didn't hurt. They didn't have to numb me at all. I will tell you, I feel like I've met a celebrity. Dr. Sawyer is so chic and so personable and is clearly like such a wealth of incredible experience and information. I just want to soak up all of her knowledge and also her tell me like the secrets to my skin. What a treat. Now, she only really gets 5 to 10 minutes with you as a patient. So when you're going into your appointment, make sure you're really prepared with what your realistic concerns are, what you're hoping to get from it, and any pressing questions. I am a huge fan of making a note on a piece of paper or your phone to go like rapid fire. What's really cool about this practice and how they have everything down, you actually talk with a consultant who has worked personally with Dr. Sawyer for a decade. They have this process where you're going to talk to Rachel, the consultant, and about all your things, all the things. And then Rachel is able to distill and convey to Dr. Sawyer in a way that is like magic a little bit. All right, I'm sitting here with Rachel. So would a patient make an appointment to see you, and then they would come into office, sit face to face, talk about all these things, and then they would schedule their appointment with the doctor? What is the timeline for people typically?
Depending on their service, it really depends. Sometimes it's as simple as doing, monthly facials. We have a handful of estheticians, so that availability can sometimes be a little bit more predominant than, say, a filler appointment or something with Dr. Sawyer or Dr. Zabalinski. So it really just depends on what they're doing.
Do you see like what are the top 3 or 4 concerns that you hear from your consults?
Yeah, usually the fine lines and wrinkles, texture of the skin, and skin laxity. As we're trying to get to them soon enough to, with non-invasive procedures, to effectively give them a treatment. Because sometimes there are many instances where patients will come to see me, and I have to be very transparent to say that these non-invasive devices may not be appropriate for you and they may not deliver appreciable results to you. So I try to be very upfront and transparent with that. And that all depends on age and the patient.
So I was actually a little surprised to hear that at 41, I'm kind of on the late end of getting started with this. What age range or symptoms of the skin is really the time to start considering your aesthetic journey?
Absolutely, that's a great question. And again, it's all patient dependent. You could have a 25-year-old come in with very dynamic movement in her forehead, and her best friend be completely different. I think usually at about late 20s to early 30s is a good time to start investing in pro-aging.
Is coming in your late 40s or early 50s too late?
Not necessarily, no. Some patients who may have a longer journey, a longer turnaround, we can usually try to soften some of these lines, or give collagen production, whether that's with laser, whether that's with filler. And it all depends on the motivation from the patient too, and budget, of course, too, because these things certainly can add up.
Talking about the budget, because I think that's a big thing that people don't understand or very curious about and afraid to ask.
Yes, and that all depends too on the services that you're doing. If you're combining injectables with lasers, those prices can certainly add up, and it depends on the physician that you see too. Each physician is going to facilitate their suggestions differently. So one physician may tell you may need to treat other areas included with one area. Sometimes it's just one area. So I'd say on average, at the low point, people are probably starting with Botox. We say Botox, usually about at least $350 to $750, just depending on all of the areas. But that's usually about an average for most patients. A lot of offices will treat per area, and ours is usually per unit.
So I'm sure you're curious, how much did this cost? Well, this is how many units I got, and this is how many dollars it cost. And I'll mention again that Dr. Sawyer and her team invited me for this experience in exchange for sharing it with you. This is my bare face after about 5 weeks of letting the product settle and do its thing. Here are my thoughts. Okay, forehead. I have a little bit of movement at this point. You can see there's like some wrinkle activation just in this spot right here. I don't know if that's the product wearing off early or it's settling into a natural kind of way. I think when I go back, I would say, I don't love getting this, let's eliminate it. My brow. This is my expressive faces, very expressive still, which was very important to me. One thing I will note, and again, Dr. Sawyer and her team conveyed, it is so important for you to give honest feedback because it helps them refine how they map your face and get you closest to your results. So this is me being super critical. I love the brow. I love that I can move my brows because my face is so expressive and I still want to show that. I will say that one side at the beginning, like a couple weeks afterwards, this eyebrow felt a little heavy. It's still a little bit there. And it gave me a little bit of a hooded eyelid, which I don't love on me. But I think it was my fault because I sleep really hard on this side of my face. And I think maybe I moved the product a little bit. So that's important to note. It's important for them to know how you sleep on your face because then you can move things around. Now, the jowls. Okay, so I can still make but it is not pulling hard down here. And I can feel the absence of those muscles being used, which feels really good. And if it seems a little tighter, a little more toned, moving forward, I am actually going to focus some of my areas on this area to prevent the development of jowls. I'm prone to it. I am. I'm just being real. And anything I can do preventatively and long-term, I want to try that. So overall, I love the practice. I feel like I can trust them. They were not upselling me on anything. They were really informing me. Highly recommend. Okay, so if you have thoughts, questions, comments, please drop it in the comments below. I love hearing from you, and don't be afraid to share with a friend because there's so many things we discussed here that you might not get access to an expert to really hear the real about it. Okay, thanks so much for being here. See you soon.